Welcome to Wellbeing Wednesdays with Harbinder Narula on BW Wellbeing World. My guest today is Shivani Bajwa, who is certified by the Indian Association of Functional Medicine and is mentored by a consortium of 200 leading doctors. Shivani has a proactive stance in reversing ailments like thyroid issues, diabetes, and more by addressing the root cause, particularly focusing on optimizing the gut health. So, welcome Shivani to BW Wellbeing World. Thank you so much for joining us today. Shivani, let me ask you the first question, which is very basic. That what inspired you to talk about, conversations related to functional medicine, especially when we are living in a society and a country where there's a dominance of traditional approaches. you know how do you tailor your approach towards functional medicine and address the prevalent health issues in the country?
I think the one thing that's come to me naturally is to see my dad really pop in a lot of pills as I was growing up. For everything, he would always say, pop a pill. And I would always run away from it. He had to actually break the tablet a couple of times and crush it and put it in my water. And then I would be fighting about it. And I remember I had an aversion to generally taking allopathic medicines, and then that grew to, studying yoga over 10, 15 years and seeing alternative ways to treat many things that apparently were solved by a pill. And I saw a lot of the older generation in my family use it and still be stuck with diabetes and a lot of things. So I think that aversion was sort of in my DNA at some point, and then kept growing with the way I studied further. And, after researching out of intrigue that there has to be a system that is beyond using medications for flu as well. I think food and nutrition and even supplementation or lifestyle hacks started playing a much more prevalent role for me. And functional medicine happened with that thought that, okay, even with yoga, I felt a holistic approach or a macro view into even problems I was facing from my, early 30s to late 30s into my 40s. I could see as a woman with hormone changes that it was not enough. I needed to know more. So I think that, again, is a progression over the years that kept allowing me to dig further. And then so happened that COVID hit and everything went online, and we could study with the best, from across. We have access to actually a lot of information today. We have access to the best courses online. We don't have to travel and pay, expensive amounts. So, and I'm just generally a learner. So I think that also helped. So yeah, there's the context really, honestly, to being inspired to getting into the space.
Awesome. And Shivani, you also mentioned yoga. So how has your journey with yoga contributed towards holistic approach for health and wellness?
Oh, it's the core. Because if you have a program, which is apparently where you're trying to run a thread through people's problems and find or boil down to root cause analysis, one of the main things we see is that the cortisol is highly imbalanced, and the nervous systems play a lot of big roles in the gut-brain axis, and then, how the neural circuits are functioning and how they are impacting people with genuinely causing metabolic health issues in their body, and how 50% of just resetting nervous systems and balancing this stress hormone, allowing them to understand habit formations along with that, restorative yoga specifically has played a huge role in settling that for people. And then, of course, the details of everybody knowing what yoga genuinely does, right? So even if it is just generally bringing it down to parameters of the blood, we can see scientifically blood pressure is managed in that. 50% of people who were thinking they need beta blockers or statins for their cholesterol, or just about thinking about it, we averted those at least when we started. So I remember feeling validated until we came down to seeing changes even in Alzheimer's patients, in Parkinson's patients, cancer survivors, how it has, helped them sort of restructure their life, apparently with something they were told that they have to live with. So this definitely is the core of every program of mine today as well. So how do I get it in. Yes, it's not long yoga sessions that I see people want or work with well. We see 10-minute capsules working really well. Biohacks, calling it that, really, one asana with your legs up on the wall before you go to sleep helps people sleep better. So you see people take to it easily. So I've created capsules through restorative asanas as well, using oxygen breathing techniques again to manage anxiety and depression, of course, as well. Yeah.
That's very interesting because, a lot of people know what to do, right? But they don't do it. And because they have preconceived notions about acceptance of few things which are considered as new, or it just seems to be tough, or there is too much of science behind what the doctor is telling them. So it's very interesting when you tell me that, if you tell them that, okay, if you were to put your feet or legs against the wall, and then it will help you sleep better. But when it comes to things like blood pressure, which is hypertension, or diabetes, which is, almost more than half the country is dealing with something related to diabetes. Do you think things like hypertension can be cured?
I have enough validation through my own work. Of course, we've gotten people off knowing that hypertension was a triggered problem, a second referred problem. At the core of it, it could have been a glucose metabolism issue that triggered off hypertension, or mostly a mitochondrial dysfunction issue. So autoimmunity has set in post-COVID a lot. Not just because today people are eating and exercising with commitment. It's not the quintessential lazy couch person coming to you either. It is people going around with nutritionists and going around and coming to a functional medicine specialist saying, kuch to missing hai, and here is when we start telling them the difference between secondary issues for which they're taking medicines, which is, symptomatic relief, versus coming to root cause analysis of a hypertension problem. Why did you really get it? And then weaning people off their medications, absolutely 100% reversible, unless we are saying that the person has come in highly severe situations of blood markers. We tell them maybe time taken is long and we could put it in 90% remission. But most cases I'm seeing, we are just about getting them off. But yes, you have to build an entire protocol around why and when you're taking these medications off. It's not like the minute you come, you take them off because they're highly dependent. So the protocol would be, okay, let's improve the insulin levels. Let's get, making sure that through a food supplementation or lifestyle, they have understood how to balance thyroids, how to see the sluggishness in that as well and read it differently today. Or their lipid profiles or their cholesterols are high today because of the insulin issue, not really that. And then at the end of the day, how the blood pressures are just automatically settling. And then when we ask them, the energy is good, the sleep is good, the digestion is better, you're breaking your food, you don't need antacids along with it. Now can we start, depleting the dose a bit? Just check it out. That's it. It's a very mild, passive approach, frankly. When they don't know why they were taking it, because this is where it is. Apparently, they are taking it for hypertension, but they're coming with a whole laundry list of symptoms, So how has this medicine really helped when you're still complaining about anxiety, sleep, and all the other problems, fluctuations in your headaches, which are hypertension symptoms? So the medication normally is not really helping people after a point. They are actually scared because they're going to go back to the doctor, the conventional system, and they're going to be like, oh, the blood pressure on the marker is high, so let's increase the dosage, to manage it. And this is the fear psychosis, honestly, that they're just in. So I think when we work a protocol out, we have full confidence. It's a metabolic problem, referred problem. Absolutely, I would say, let's take a more safer approach on a media call that 90% we are doing a great job and we are getting this settled in people very quickly, 3 to 6 months, basically. Yeah.
And tell me one thing, there are endocrinologists available, there are diabetologists available. What draws people to you? And is there a challenge in explaining to people that, listen, we can do something which other professionals have not been able to do?
So the growing Indian market, if you ask me, because we have clients from across the world, I would say the intelligence quotient on this has become very high in the last year or two. versus earlier, definitely. Again, the access online information, people are understanding that, hey, the idea is I'm still not feeling good. So they have, and then when I have a gut problem, there's a gastro. When I have an energy problem, I'm still confused who to go to, a GP or a who, or an endo. And then when I skip a period, should I go to the gynae? So silo based that no one understands the other guy's problem. And then there are also medications that are sort of cross interfering with your problems. And the symptoms seem to just be escalating. So they're coming with a lot of background checks on what functional medicine is now. Now there is no real me convincing them on it. It's more like I fell out of this, sick of that, this. Now I'm coming to you, now you solve it. You know, the challenge and pressure on us is very high, I would say, where they are apparently also very sure that there is a system that can help them now. And it does not fail them more often than not. Definitely not.
And Shivani, you know, while answering one of your earlier questions, you also mentioned the word cancer. Now, cancer, you know, we typically do not understand still to a very large extent that what is causing the cancer. You know, second is we still don't have a cure for cancer. There's a lot of confusion whether a patient of cancer should be given chemotherapy or should that be avoided. That's a confusion that exists in everybody's mind today. Now, while I'm talking about this, we also have understood that cancer could be trauma related or an outcome of something else, right? Can you share a personal anecdote of your observing your patients or people around you that solidified the commitment to combating conditions such as cancer or other trauma related ailments through functional medicine?
Yes, of course. So I personally had a case where I had a lump in the breast, and you know, having all the years of knowledge and trying to eat right or doing it right, of course, with a lot of activities and habits over the years of being wild as well, you would start attributing that lump to those years, you know, and say, oh, I did it then, so now I'm suffering for it, you know. But having said that, of course, by the grace of God, it was not cancerous, but it really got me thinking in the years again that it was a collection of fibroid, which is a collection of toxin, which is a highly inflamed body that managed to collect such a big lump in the breast. That means when I went back, I said, okay, I could have eaten right, I could have exercised right, but man, I just didn't know how to handle stress. You know, I just didn't know how to handle the pressures of life. I didn't know how to react or respond to it. I had issues with managing relationships, multitasking at the same time, and did that all clog my way to be, yeah. So at the core of a lot of cancer starts the snowballing of the way you have managed life overall many years earlier. And I think when we unfurl that for a person where we just hear about blood markers going off and fibroids maybe starting in women, you know, also in their ovaries or cysts starting, my discussion with them is, hey, I mean, please stop thinking about weight and all right now, man. We're going to get you first disease free. The fact is that you're heading towards so much inflammation, endocrine disruption on top of it. You're using beauty hair colors, there's pollution in the air, there's glyphosate in your herbicides in your food, you're eating out so much more, you're using omega-6 oils without knowing. There's so much happening to the body that when you're collecting all of it, it is now just a lump of fire moving all over the place. So can cancer be that? And can we look at it really becoming that after a few years? So yes, I think the narrative has to change for cancer. It's mostly very lifestyle related, predominantly poor habits and poor ways to handle stress, definitely. And I've gone through it personally, as you asked.
So, do you think cancer can be cured?
That's a relatively...
if it is beyond, if it is more to do with stress causing it, if you were to remove stress, do you think the situation would be improved or managed better?
It's not, it cannot be answered like that so easily. It is a large question, but if you just sort of break it down into a few pieces or parts, I think if we've got cancer patients or cancer survivors, two different things, right? If a cancer patient is coming, when you evaluate the madness or chaos that's going on in the other panels of the blood, which is already not being solved because also the habits of the person have been ingrained in them, and I don't see it really changing, or the person has now spread that cancer so far beyond our control, that can we make the symptoms go less? Yes. Have we done that? Can we help them tolerate the radiation better? Yes, we've done that. The chemotherapies? Yes, we've done that. I wouldn't say that we managed to cure a person of cancer like that. On the onset, we won't know that we were the reason if someone felt like they had been cured of it as well. I won't be able to say validated with research, it's only that. But I can say that at many severity levels, that can be managed. Also, like I said, we can avert the signals of cancer. So it is going to be very, very case-based, because what kind of cancer, if it's blood, then again, it spreads just too fast. So we have to see it case on case. But there's full hope in lifestyle that can make the person live a very, very comfortable life with it, and even cure it. People are doing it. There are holistic lifestyle cases where people have cured it. They are claiming it on Instagram at least. So that's, and I do believe them that they have actually.
I'm sure.
So I've just not come around a case where I have cured it.
Got it. And Shivani, you are very, very aggressively, ambitiously talking about gut health, right?
One of the things, because now it's such an overcrowded space that it's becoming almost irritating when people are like, oh, you handle gut health. I'm like, yeah, just handle gut health. Yeah, just don't reduce me to that, please. But yeah, the core of a lot of everywhere, if we don't have the assimilation and the movement of the food going on correct, then how is the glucose getting managed, or the energies, or the ATP cycling? There's no way that you can avoid the gut health in any situation today. That's it. That's according to me.
Right. And Shivani, what role do you see of herbs and vitamins that play in your treatment protocols that you are using? How do they complement the functional medicine and yoga practices?
So this country takes no time to supplement shame, but the same people are popping 100 medicines. That's the beauty of it. हम इतने supplement नहीं लेते. अच्छा, क्या क्या ले रहे हैं आप? एंटासिड हर हफ्ते ले रहे हैं आप. अच्छा आप स्टैटिन भी ले रहे हैं आप. ये थायराइड एमसीजी, हाँ थायरोनॉम चल रहा है 125 एमसीजी, बस 3-4 ये चल रहे हैं, और साथ में हम D3 भी ले रहे हैं. आपको पता होना चाहिए. तो firstly the vitamin D apparently is the only supplement on the planet that apparently is there, because everyone thinks they're eating supplements right now, vitamins, without any understanding that our bodies here who regulate the vitamin D as well don't allow a certain amount of IU, which is useless for people to manage vitamin D, like absolutely useless in the levels. So vitamins and supplements, if you don't know or you've not been trained in it and you don't understand how they crisscross, not one supplement takes care of one trigger or anything. But in my practice, it speeds my process with people who are highly deficit in a lot of things, which I don't see sometimes food helping, because they can hardly digest half of them. And sometimes when you have these blanket approaches that have flaxseed for your thyroid, you know how much flaxseed you'll need to eat for your thyroid then? 2-3 boris a day. Are you eating that? So what I'm saying is that the potency, the extract, the amount of the foods you're claiming that have, 5 foods you need for diabetes, and then someone's flashing this. Do you know how much of that you need for you to manage things in the week? So I don't see it. I see it coming complementing the food. But most importantly, building motivation and faith in people feeling like bloating is going, and they're feeling lighter on their feet. And hey, if it can happen in 20 days, they've been suffering for years with it, or 2 years and 3 years, even if at the least someone comes with 6 months. If 15 days makes them motivated and there's no side effect on it, then I am actually using vitamin supplements a lot as well. But at the least combination, wherever the support is not being managed with the biohacking of the lifestyle and the food, is where I see the supplement playing a role, definitely.
So since we are talking about, the understanding of people on the supplements and the medications that they're taking, how do you approach educating patients about reducing dependency on medications like thyroid drugs, or, I've seen a lot of people suffering from anxiety leading to depression, so they are on antidepressants,
Sure.
through lifestyle changes and holistic treatments, so that, they are not addicted to the medication for the rest of their life.
This is such a valid question, actually. So I'll just give you a case study example, and it'll be easier for your viewers to get this. So if you have a thyroid problem today, what happens is you're taking your medications and you are apparently chasing TSH. Okay, number one thing on educating people is when we ask them to get many more panels with thyroid done to check the reasons why maybe this thyroid has gotten sluggish is mostly an autoimmune condition called Hashimoto's. So when we say आप तो पैनल ही अपना इनकम्प्लीट करा रहे हैं, TSH तो आप अकेले देख रहे हैं, it's not even a thyroid hormone, it's a pituitary hormone. Come, I will tell you what it really means. We check free T3 or T3 and T4 levels. We check anti-TPO and TG, which no endos are actually ordering today for people. So when we do that, then we start explaining that we are actually having thyroid medications, which are inactive replicas of hormones, which your body is making beautifully on its own. You're just adding more of it. And second problem is it causes low stomach acid, which is the root cause of most of the sluggish thyroid. So you're sort of venturing back into a vicious cycle with the medications, which are pretty overused and unnecessary and handed over probably to most cases at the wrong time, because the primary healthcare system in the country, which I could get into trouble for saying this right now, but they are seeming to not move forward from there, And when we have people going off thyroid meds, we have a proper protocol for it, which is X things have to get better for me to challenge the medication now that you're dependent. So if I don't improve the liver functioning, which is where 80% of your active thyroid hormone is made, or 20% is made in the gut, I don't improve your infections that I see in your eosinophil count or whatever, your thyroid hormone itself is not functioning on its own. So firstly, the education is coming with how to read your lab markers differently, how to see what are the scientific protocols to improve the thyroid functioning. Then weaning off an unnecessary drug becomes very easy to explain because they're feeling good. It's coming in the real time, So this is the way we're actually working with antidepressants also. We stitch the whole program, wait for it, wait for the sleep to get better, wait for the happy hormones to kick in, understand dopamine reward systems, explain how to build habits. Mm-hmm. And there you go. Can we reduce the anxiety on alternate days? Yeah, sure. Let me try. Did you feel any different? No, I'm still feeling okay. Okay. Let's try, not using it for a week now. So it's a negotiation going on at the right time, mostly when we're weaning them off, but it comes with the real-time action of feeling good as well. So we have to support it before we wean them off, basically.
So, Shivani, this brings me to my next question. I mean, at the end of the day, when we're talking about feeling good, and here you are dealing with the patients directly, in your experience, how does addressing the underlying emotional and mental health issues contribute to physical healing? And what are the kind of modalities do you use to support your patients in this aspect? I mean, even if you look at, homeopathy for that matter, and a lot of allopathic practitioners challenge that particular system, but they spend a lot of time trying to understand the patient's background, their environment, and they feel that, that is what is affecting or could be affecting their physical well-being as well.
It's absolutely a simple example of emotional well-being coming from outside stress, which is trauma happening in your life, or you having challenges in your life, right? Which are out of the ordinary for a person who's living a basic routine life, for example. So if it is a relationship that's gone wrong, or there is a traumatic event in the family, or, you've had a health setback generally, your body is generally going through an external event, stress event, right? Versus something we tell them that there is something called the way the body tolerates that stress. Okay. Now you and me may be put as focus groups today, and we both are put with the same stress that happens to us. I may genuinely have trained my emotional body, neural circuits, nervous systems in a way that I can handle the onset of the stress. So there's an internal button to switch on without worrying what's going to come next. Okay, so that is one thing that we talk about. Emotional well-being is also training the mind like a muscle. Okay, you can't ignore the exposure to sunshine in the morning, what it does genuinely for all the adrenaline and all your other neurotransmitters in the body. So second thing is, you're probably feeling off with emotional well-being because scientifically the gut is leaking where all the happy hormones lie. So if I plug that, automatically things will start making you feel better. So identifying that the external stress events are there and will happen, even if they're not happening now, we can't really take charge of that. But training yourself to handle that, is a proper process, using breath, oxygen tools, using neuroplasticity today, by the way. You're using the exposure to simple restorative yoga asanas, how to unwind for your bed, for example, to have better circadian rhythms, how to train a person where, like I said, the training is something that I'm doing without the person saying, hey, I even have any stress in my life, actually. So it is that, do you know what's going to come next and how will you manage it? And if your basic body habits of eating or poor diets and lifestyles are going to increase glucose so much, it leaches onto vitamin D, for example, the most, So that's why UAE in India are suffering a lot and using a lot of antidepressants, because our diets are high on grain, high on sugar. So vitamin D has been linked directly in all studies today and researches to depression. So it comes down to even children who are snacking a lot and using a lot of blue light. They're leaching on vitamin Ds and mags. They are using a lot of antidepressants today at 18 and 19. I have a lot of cases. But when they're coming, it looks like the mother thinks that this is never going, But absolutely, when we rework the logic behind it to them and say, there are 6 things that could be causing your depression. Let's start one by one. Let's see where the real results lie for us, 20%, 30%, 20%, So you stitch your program together, absolutely work on the emotional well-being, trigger a system where you are training yourself to handle the outside stress now, and tolerating it better is a very big signal. Heart is not racing now in the middle of the day suddenly because you're managing stress better. So you can actually have tangible understanding of changes over a few weeks as well. So we actually boil down to, what are your symptoms? When you feel low, what are your symptoms? At that point, journal it, tell me. It could just be a sugar dip. Women go through hypoglycemia, and we just put back electrolyte. And they're like, oh, now we're not feeling that low in the afternoon. So really, really, like you said, how homeopaths boil down to, stacking all the symptoms. That's how emotional well-being can be broken down, honestly.
And, Shivani, how do you overcome the challenge of educating people, or the people who come to you, about the interconnectedness of the mind, body, spirit in achieving the optimal health? Because, the reason I'm asking you this is because people are looking at quick fix. They want things to be working out for them really fast. And if you were to do a treatment or a therapy based on these 3 things to come together, it will take time, And so are there also any resources or tools that you use to work with your patients on this?
Oh, you mean building patience levels?
I'm not.
Yeah, it's called being a matron at times. It works very well. And 2 is have full confidence in what you're doing. And 3 is that if you don't want to have it, then please go about doing your thing and come back when you're in trouble, So I actually am not here to build your patience levels about it. Okay, I'm very clear. Actually, I'm being honest today. You're coming to me on your own thought. It's not my responsibility to change the world on how to build it. Yes, comforting them is a process. But an attitude shift also, by the way, I've gotten around people. But I would say most often, because of the speed of how we boil down to, listen, timelines. These are 10 problems you're complaining about. We're going to work with 2 in this month, where you're going to see significant changes. You're not going to talk to me about hair fall for the next 6 months. Please do whatever you can. It's an autoimmune condition, hair fall. Being honest about timelines, working with shorter, smaller goals have really worked for me. And whenever the person is digressing to, I'm not losing weight, it's very simple. okay, why don't I do one thing? Why don't I make you fast for 24 hours? You'll start losing weight. Can you do it? So you just put the onus back on them, on how the energy is, how the sleep is. I mean, the logic of the science. But I'm generally comforting an intelligent client. I'm not coercing an impatient client anymore. That's not what I'm doing anymore. They are to fail at many things and come to me. And so then I feel you've done your research and you know timelines. But like I said, shorter, smaller goals with logic work wonders for them.
But is there an overlap of a role that you play with your patients? I mean, a role of a mental health specialist as well, because, and the reason I'm asking you this is because, Shivani, a lot of patients, I keep telling everyone, अपने lawyers और अपने doctor से कुछ मत छुपाओ. But आपको ये भी पता है कि 90% of the people are not open about many challenges that they may be facing, which could be contributing towards their physical health as well.
We already built that internal system without having to get into their personal life much. All I would say, unless they have had a moment or two to vent out. Okay, then you're basically a listener at that point. However, you're not engaging with them in their personal life, because I'm not a trained counselor on that, right? Apparently. So, but I think I do a pretty good job in getting into understanding where they're coming from. And because of the yoga background, I think the intuitive sense of connecting to people and healing sort of situations is pretty high, I would say. So yes, not engaging in personal events of theirs is important, because that's where I see a trained person coming in for it. We do recommend people from our panel to talk to people after a point we feel that really this person needs the help, where they need this part of the therapy also. So I do include it for a few people, not everyone, where I do see dead ends being hit. Okay. But because I'm constantly telling them that, boss, if not going to manage these changes for me, and you're not going to sleep better for me, and you're not going to manage your yoga real-time stuff, because when you are feeling low and that is improving, you're not going to really do the action work. I'm not talking to you only, So my team is actually, I would say, give it to them that their job generally entails being at that point, but they go beyond themselves because they see how passionate I am about that the tracking of this part of their life genuinely gives them 60% relief. So the next 30, 40, if they're stuck, if someone is not going beyond that and we can't improve them, then yes, I think interventions of talking have helped or counseling have helped. But mental health is generally a challenge with someone who can't metabolize glucose only. Itna sugar body mein ki brain fog itna ho gaya hai that they're going to feel low. So there's no question of not managing emotional health through tools and techniques, without having to engage in their, like I said, personal life.
And Shivani, I've asked you a lot of questions about you, how you work, and what is working in your practice. But let me ask you a question which could be more valuable to the patients. There are and also I think you're the right person to ask, because you're talking about food and nutrition, you're talking about yoga, and you're talking about diabetes. So there are two things that are confusing people today. You remember there was a time when people were confused about desi ghee khana hai, nahi khana hai. Okay. So there is this thing about avoiding wheat. Roti mat khao aaj ki date mein. Aur dusri cheez is, even a lot of doctors are talking about milk. Doodh mat lo. And we are talking of the earlier generation where it was told that, doodh to ek cup roz peena hi peena. And so what is your take on this?
Very clear take, actually. No food group is to be villainized, number one. Yeah. But two, having said that, the way our dadi, nani, mummy, papa had the wheat, the processing of that wheat was very different to the wheat today. So one thing is that it has something called gluten, which is a protein in it, in gluten. Wheat, we're talking about, number one, which is very big. But in case you're already coming with Hashimoto's thyroid, leaky guts, infections that we are seeing, H. pylori's, bloating, constipation, what does that leaky gut mean to you? And what is the connection with gluten is simple. You have a cup and you have a strainer, for example, and that strainer has holes. So all the stuff that's not needed is going in. Now, every time you eat gluten, the holes, it will tear further because the protein sizes are big in it. Now, because it's processed differently, so it affects people in autoimmunity big time today. So thyroid patients and gluten, yes, avoid till we seal that leaky gut for you, till the strainer is sealed, till the toxins are clean from before, till the environment of the body has gone low on inflammation and low on oxidative stress. So gluten plays a role there. Two, because most people have low stomach acids and pH levels of the gut, which have been hindered because of it. They're not breaking, unfortunately, big protein sizes foods. So they're getting regurgitation. So in these matters, what we do is we are getting you out of it for a bit to get you to eat it a little bit, because we're Indians, we're going to eat it, but it's not going to affect you after a few months when I've cleaned you up. So don't villainize the food. See the logic of the problem at that point. Do we need to move it? Now, if that's not the case for women who are coming with, say, PCOS, or they're coming with irregular period, or they're having issues in fertility today, or endometrial issues, what does dairy do to them? Dairy genuinely has a lot of estrogen hormone in it today. And most of them are suffering from a dominance of that because it's not leaving the body. It's bad estrogen clogging. And because of that, they have all these conditions going crazy in their body. The dairy is adding to their trouble at that point. So at that point, again, the relevance and the context of removing dairy is a woman is saying, my goodness, my body inflammation pains have gone down, the period cramps have gone down. I'm, feeling definitely more, I'm feeling happier, So there is where the food groups lie, and the discussion on building a case for that person, individual case on food. Would make more sense than going with a blanket approach of gluten and dairy being evil, at this level.
Shivani, I think this has been a brilliant conversation, because this is not just for the patients, but also a lot of learning for fellow practitioners. My three takeaways from this conversation, Shivani, have been that, one, for the patients or people who are seeking help, it is absolutely clear that holistic, and I'm talking about holistic, I'm not even talking about allopathy versus homeopathy or Ayurveda. I'm talking about some form of medication along with your food and nutrition, your mental well-being, yoga. All of this together has to work. So there is no one size fits all, and there is no one thing that works for everything. So you need to seek help, but you have to work on yourself. So you have to be very clear in your mind in terms of what is it that you want to do to help yourself, seeking the help from the right people. Second thing is that, you mentioned very beautifully that feeling of being understood is the need of the hour for any practitioner, because when the patients are coming in, they have all kinds of help that they are taking, or they have taken, or they could consider, but they're confused. So they want to be understood, and that is what will help the practitioner do a lot of justice to how they will treat them. And because all of these things work together, so I think the future is more towards integrated medicine, which it has to go beyond the holistic well-being as we see today. It has to expand further. And third, for the practitioners like you who are wanting to be inspired by you, one thing, and they're dealing with the same issues that you may have dealt with, that why should we come to you and not endocrinologist, or why not go to a medical specialist? Because first thing you have to do is to have confidence in yourself and what you can do to make a difference to someone, and have the right intention to be of help.
Absolutely.
So those were the three takeaways that I could gather from this conversation of ours. I really thank you for having this conversation. I really thank you for taking our time to be talking to us today.
So beautifully summarized, Arvind. Thank you. Thank you for having me. It's always really exciting to reach out to more people with this. This country at least is finding that beat, that vibe to, understand functional medicine now. And it's very exciting time also, because we're reversing so many issues and we're getting the blessings here. We're getting the confidence from everybody. So yeah, fellow practitioners, fellow functional medicine specialists, I hope more and more come about, because that way more and more people are going to use less medications and feel better very soon, and have faith that they can reverse most of their conditions as well. But thank you so very much.
Absolutely. Thank you.